Hello everyone, welcome to Dental Shots. Today we are going to see the protein specific for Cementum, which is the part 8 of Cementum series. In this video, we are going to concentrate on Cementum derived attachment proteins. What is the clinical significance? After any periodontal surgical instrumentation of the root surface, it is exposed to the oral environment and it is influenced by the Cementum derived attachment proteins. So in short, we call them as Cementum attachment protein CAP. These are the markers of developing cementoblast. This CAP is invariably detected in the acellular extrinsic fiber cementum. So there is an increased presence of CAP in a cementoid matrix that is laid down prior to the formation of acellular extrinsic fiber cementum in a developing tooth. This CAP is thought to be chemotactic and a differentiation inducing protein which provides an attachment to the PDL fibers, and hence a CAP, the cementum attachment protein, is a definitive marker for the cementum, and this protein is not isolated from the bone. On evaluating the recent studies made in cementum, the role of collagenous cementum derived protein, that is CAP, which promotes the adhesion and spreading of mesenchymal cells with the osteoblast and PDL fibroblast. The PDL fibroblast shows a better adhesion due to the CAP than the gingival fibroblast and keratinocytes matrix. I hope you like the video and do not forget to see the part 9 of Cementum series regarding the cells of cementum.